This is part 2 of the primer. Unfortunately, I'd left off in the middle of my replication cycle, but where we had left off, the polymerase had just finished making the negative strand. As you can see, the positive strand RNA is the original RNA that serves as the template for transcription for the negative strand. The negative strand then serves as the template for transcription of a new progeny positive strand RNA. The process can repeat itself as many times as needed. Meanwhile, the structural proteins formed from polypeptide cleavage have now matured. These proteins reassemble with the positive strand RNA and are now ready to fuse at the host cell plasma membrane. The process is now ready to repeat itself. It is worth spending a bit of time discussing why the RNA polymerase is unique in hepatitis C. It is a low-fidelity enzyme, which basically means it lacks a proofreading mechanism, such that it is highly error-prone. This, coupled with the high replication rate, leads to a high rate of mutations. Thus, as we will see, despite the fact that the genome is quite simple, there is a lot of heterogeneity. This genomic heterogeneity means that many new variant viruses are formed because of the frequent mutations, and a collection of closely related quasi-species are considered relatively homologous strains. The obvious consequence of this heterogeneity is the survival advantage conferred to the virus. Interestingly, the reduction in diversity of species within a host has been associated with both the progression of the disease as well as the clearance of the infection. Now, the concept of genetic heterogeneity and quasi-species should be distinguished from genotypes. Hepatitis C has its own genus, but is characterized by 6 main types, which are known as genotypes. There are 6 genotypes, and approximately 100 subtypes described. Where these genotypes differ primarily is in their susceptibility to treatment with antiviral drugs, as well as their metabolic effects. Thank you for the figure provided by John Hopkins. As you can see here, the genotype distribution is such that genotypes 1 to 3 are found pretty much worldwide, whereas genotypes 4 and 5 are primarily found in Africa, and genotype 6 is primarily found in Asia. For purposes of North America, it is easy to remember that genotypes 1 to 3 are the predominant types and are ordered correctly if you look at the numbers, with genotype 1 accounting for at least 2/3 to 3/4 of hepatitis C infections, whereas genotype 2 for about 15%. Unfortunately, genotype 1 and 4 are relatively resistant to treatment.